Welcome back to the PTCB Top 200 Drug Series. I'm Izzy, certified pharmacy technician with 9 years of experience. 5 episodes in, 50 drugs. Today we learn opioids, NSAIDs, and DEA scheduling. This class has its own dedicated domain on the PTCB exam: pain management and controlled substances. This isn't just pharmacology, it's federal law. The federal requirements domain makes up 12.5% of your PTCB exam score, and DEA scheduling questions live right in the middle of it. 10 drugs, 2 classes, 1 scheduling framework, dispensing rules you cannot miss, and 5 practice questions at the end. Let's go. Here is the framework first. The DEA, the Drug Enforcement Administration, classifies controlled substances into 5 schedules based on their abuse potential and whether they have an accepted medical use in the United States. Schedule 1 through Schedule 5. Roman numerals 1 through 5. Here is the trick. The Roman numeral and the restriction move in opposite directions. Higher schedule number equals lower restriction. Lower schedule number equals higher restriction. I'll say it again. Because this framework answers multiple exam questions by itself. Higher number, lower restriction, lower number, higher restriction. Schedule 1. Highest abuse potential, no accepted medical use. Heroin, LSD, marijuana at the federal level. These cannot be prescribed, they cannot be dispensed. Full stop. Schedule 2. High abuse potential, accepted medical use, but severe dependence is possible. This is where almost every major opioid lives. Morphine, oxycodone, hydrocodone, fentanyl. These are Schedule 2 drugs. The single most important dispensing rule you must walk into this exam knowing: Schedule 2 drugs cannot be refilled. Not once, ever. A new written prescription is required every single time. Schedule 3. Moderate abuse potential. Some dependence risk, but less than. Schedule 2. Buprenorphine lives here. Codeine combination products, like Tylenol with codeine, live here. Up to 5 refills within 6 months. Schedule 4. Lower abuse potential. This is where Tramadol lives, and that is the exam trap I will come back to in a moment. Benzodiazepines live here too. Alprazolam, diazepam, up to 5 refills within 6 months. Schedule 5. The lowest controlled substance classification. Cough preparations with small amounts of codeine fall here. The PTCB may ask about Schedule 5 OTC dispensing requirements. Some states allow pharmacist-supervised sale without a prescription. Know that this varies by state. Now 2 more dispensing rules the exam loves for Schedule 2 specifically. Emergency verbal orders. Under normal circumstances, Schedule 2 prescriptions cannot be called in by phone. In a documented emergency, a prescriber can verbally authorize the pharmacist to dispense, but the written prescription must arrive at the pharmacy within 7 days. Know the exception and know the deadline. The exam has tested both halves of that rule. Partial fills. If a pharmacy doesn't have enough Schedule 2 medication in stock, a partial fill is allowed. But the remaining quantity must be dispensed within 30 days, or the prescription is void. The exam may present a scenario about inventory shortages. This is the rule that applies. Now the Tramadol trap. Tramadol acts like an opioid. It binds opioid receptors and also works on serotonin and norepinephrine. Students almost always assume it's Schedule 2. It is not. Tramadol is Schedule 4. If a PTCB question describes an opioid-like analgesic with a lower scheduling classification than morphine, Tramadol is the answer. Ultram is its brand name. That distinction is worth memorizing cold. Let's lock in the brand to generic connections. Opioids first. Morphine, brand name, MS Contin. MS stands for morphine sulfate. Contin stands for continuous release. This is an extended-release tablet. Schedule 2. No refills. The foundational opioid all others are measured against. Think, MS Contin contains morphine, sustained. Oxycodone. 2 brand names the PTCB tests separately. OxyContin. Oxycodone alone, extended release, Schedule 2. Percocet. Oxycodone combined with acetaminophen, immediate release, also Schedule 2. The exam may ask which formulation contains acetaminophen. Percocet contains APAP. OxyContin does not. Know the difference. Hydrocodone with acetaminophen. Brand name, Vicodin. Schedule II. Important historical fact. Hydrocodone combination products were rescheduled from Schedule III to Schedule II in 2014. The exam knows the current schedule is 2, not 3. Think, Vicodin. Victory over pain, but tightly controlled. Fentanyl. Brand name, Duragesic. This comes as a transdermal patch, applied to the skin, changed every 72 hours. Schedule II. Used only for patients already tolerant to opioids, never for opioid-naive patients. The exam may present a scenario where fentanyl is prescribed inappropriately. Opioid tolerance is the prerequisite. Think, Duragesic. Durable, continuous analgesia through the skin. Tramadol, brand name Ultram. Schedule IV, not Schedule II, carries risk of serotonin syndrome when combined with SSRIs or SNRIs. The exam may pair this with Episode 4's antidepressant content. Think Ultram, the ultimate trap on your scheduling exam. Codeine with acetaminophen. Brand name, Tylenol with codeine number 3. Written TC3. Schedule III. The number 3 in the brand name corresponds to the codeine content. TC3 contains 30 milligrams of codeine. TC4 contains 60 milligrams. Know the schedule, know the codeine dose, and know that combination codeine products are Schedule III, not Schedule II. The exam has tested all 3 facts. Now NSAIDs, non-steroidal anti-inflammatory drugs, not controlled substances, but they appear on the PTCB regularly because of OTC versus RX status, mechanism differences, and counseling rules. Ibuprofen. Brand names Advil and Motrin. Available OTC and by prescription. Non-selective KIOX inhibitor. It blocks both KIOX-1 and KIOX-2 enzymes. KIOX-1 protects the stomach lining. KIOX-2 drives inflammation. Block both and you get anti-inflammatory effects plus GI irritation risk. The exam may ask about this mechanism in a patient with a history of ulcers. Think Advil, the all-around anti-inflammatory. Naproxen. Brand names Aleve as OTC and Naprosyn as RX. Also non-selective. Longer duration than ibuprofen. Twice daily dosing instead of 3 times daily. Think Naprosyn naps. It works longer between doses. Ketorolac. Brand name Toradol. Prescription only. Used for moderate to severe acute pain as an opioid-sparing alternative. Here is the rule the PTCB will test. Maximum 5 days of use. Not 6, not 7. 5 days. And then it must be stopped because of serious GI and renal risks with prolonged use. Think Toradol. Total pain relief, but only a short tour. Celecoxib. Brand name Celebrex. This is the class distinction question on the exam. Celecoxib is a COX-2 selective inhibitor. It blocks only COX-2 and spares COX-1, which means it preserves the stomach's protective lining. Patients with arthritis and GI sensitivity may be prescribed Celebrex specifically because of this. Think Celebrex celebrates the stomach by sparing COX-1. All right, 5 questions. PTCB format. Question 1. A patient brings in a prescription for OxyContin. How many refills may the pharmacist dispense? A. 5 refills within 6 months. B. 1 refill with prescriber authorization. C. No refills. A new prescription is required every time. D. 3 refills within 30 days. The answer is C. No refills. OxyContin is oxycodone. Schedule II. Schedule II drugs cannot be refilled under any circumstances. A new written prescription is required for every single fill. This is the most frequently tested Schedule II rule on the PTCB. Question 2. A prescriber calls the pharmacy with an emergency verbal order for a Schedule II medication. What must happen next? A. Nothing. A verbal order is permanently valid. B. The written prescription must arrive within 7 days. C. A pharmacist must document and co-sign the call. D. A new prescription is required within 24 hours. The answer is B. The written prescription must arrive within 7 days. Emergency verbal orders for Schedule II are permitted, but the follow-up written RX must reach the pharmacy within 7 days. Know the exception. Know the deadline. The exam tests both halves. Question 3. A patient is prescribed Tramadol for back pain. What is the correct DEA schedule? A. Schedule 2. B. Schedule 3. C. Schedule 4. D. Schedule 5. The answer is C. Schedule 4. Not Schedule 2. Tramadol acts like an opioid, but its federal classification is Schedule 4. This is the most commonly missed scheduling question in this category. Ultram. Schedule 4. Lock it in. Question 4. A patient picking up Toradol asks how many days they can take it. What is the correct answer? A. 10 days. B. 30 days. C. 5 days. D. As long as needed for pain control. The answer is C. 5 days. Ketorolac has a hard 5-day maximum. Extended use causes serious GI and renal toxicity. The PTCB loves this rule because it's specific and testable. 5 days, not more. Question 5. A patient with a history of stomach ulcers needs a long-term NSAID for arthritis. Which is most appropriate? A. Ibuprofen. B. Naproxen. C. Ketorolac. D. Celecoxib. The answer is D. Celecoxib. It's the KIOX2 selective inhibitor. Spares KIOX1, which protects the stomach lining. For a patient with a GI history, Celebrex is the appropriate NSAID choice, and the PTCB knows exactly how to ask this question. 10 drugs, 2 classes, 1 scheduling framework that unlocks an entire exam domain, 1 Tramadol trap that separates the people who studied from the people who guessed, and dispensing rules that reflect real pharmacy law, the same rules I follow every single day behind the counter. You have now covered 60 of the top 200 drugs across 6 episodes. More importantly, you know the logic. You know the suffixes, the schedules, the devices, the mechanisms, the allergy crossovers, and the counseling points that make real pharmacy technicians different from people who simply memorized a list. That is what this series was built to give you. Thank you for watching. Drop a comment. Which episode helped you most? Which drug class surprised you? If you want to keep studying with me, subscribe. There is more on the way. I'm Izzy, and I'll see you in the next one.